Hello everyone, welcome to Pediatrics and Neonatology. The video is about overstimulation in babies. I will discuss the sign, causes, remedies, and how to prevent it. Engaging with your babies is crucial for their development. Talking to them, making silly faces, taking them out for walks, and having them meet friends and doing age-appropriate activities are all great ways to introduce the infants to the world around them. But just as with anything, it is totally possible to overdo it. Similar to adults, babies can become overwhelmed by the activities and environments. Now, first of all, what is an overstimulated baby? Overstimulation occurs when a baby or a child experiences more stimuli that they can handle or are used to. Overstimulation in babies and toddlers can happen at any age, but it may be especially common from about 2 weeks to first 3 to 4 months of life. Now, what are the signs? On a biological level, overstimulation in babies lead their bodies to produce a stress hormone which is called cortisol. Cortisol stimulates sympathetic nervous system, which is a part of our bodies responsible for the flight or fight response. As a result, heart rate increases, breathing becomes more rapid, and muscles tighten. Now, overstimulation looks a little different in every child, but there are some common signs you might notice in a baby. These include crying, usually louder than usual, withdrawing from your touch or turning head away from you, acting fussy or irritable, not wanting to be held, though older baby may actually become clingy, refusing to nurse or wanting to nurse more frequently, appearing tired, clenching fists, waving arms or legs, acting scared or jerking movements, needing extra comfort measures such as pacifiers, or engaging in self-soothing measures such as sucking on hands, thumbs or fist. Now, what are the causes of overstimulation in babies? Every child is different, but some of the things that could overwhelm your baby include: number one, environment. Some babies might get overwhelmed by noisy, crowded, brightly lit or colorful places. Then excessive screen use. TV, phones and other devices can all be too much for a baby's brain to process before they are at least 18 months old. Then missing a nap. Being overly tired can quickly overwhelm your baby. Next is disruption in routine. Babies are creatures of habit, and a schedule change can make them cranky. Then too many people. Some babies might like meeting a lot of people, while others will get quickly overwhelmed by new faces or crowds. Then temperature. Getting too cold or warm can play a role in overstimulation. Next is teething. Although temporary, teething can irritate your baby and make them less tolerant to other stimuli. And the last is certain medical conditions. For instance, autistic children have a more sensitive sensory system, so it is easier for sights, sounds, touch, smells or taste to overwhelm them. Now, how to soothe or calm an overstimulated baby? First, remove from the situation. When you notice that your baby is overstimulated, the first step you should take is to change the environment to someplace quieter and darker. This can be the nursery, a dark room in the house, a baby wrap or carrier on your chest, a stroller or even his car seat. And if possible, avoid bright colors because they can be stimulating, and talk to your baby in a calm, soft voice. Next, swaddle your baby. Swaddling applies steady pressure, mimics the coziness of the womb, and dull their startle reflex, which some babies find soothing. However, not all babies like being swaddled, so if yours doesn't, then it is okay. Next is soothe your baby with white noise. You can also play soft music without lyrics or turn on a sound machine or white noise machine. Just avoid TV or phones. They are too stimulating for children under age 2. Next, carry or hold your baby. Some babies want to be held or touched, but many don't. If your little ones seem to pull away from your touch, Then lay them down on their back in a safe place, like their crib, and sit nearby until they calm down. And the last, feeding or nursing. If your baby is showing sign of overstimulation, feeding or nursing can be a way of soothing them. Now, here are some tips to prevent overstimulation in a baby. First is schedule breaks. Make sure your child gets breaks between different activities or events. For example, if you go to the park, make sure your baby gets time to nap at the home after. Or if you are introducing your baby to friends and family, then take him to a quiet room for small breaks. The break should be in a quite familiar place that your baby knows well. Then keep things short. Your baby, especially in those first few months, isn't ready for marathon days full of errands, meetings, and more. So try to schedule outings in short, predictable increments. Now create a routine and stick to it. Try to stick to a set of feeding, meal time, nap time, and bedtime schedule, even if you are away from the home. Next, limit screens. Screens should be avoided, especially under age 2. Then respect your child's personality. If your baby gets overstimulated around big crowds, respect that. You are not going to change his personality by overwhelming him. Then last, reach out if you need help. A doctor can help you tell the difference between what's normal and what's not. Okay friends, thanks for watching. Please like, share, comment and subscribe to my YouTube channel for more informative health related videos.